Hi. Well, I thought in today's video we would talk a little bit about depression, as that's something that often comes up in counseling sessions and often goes along with other concerns that come up, such as eating disorders, certainly postpartum concerns after someone has a baby, just kind of things like that. And so, we won't go into a lot of depth in this video, but there are a lot of things that really can contribute to depression. Certainly a big factor might just be if there's a family history of it. And in that case, definitely want to recommend going to see a psychiatric provider and seeing if medication might be helpful in that sense. But for the purpose of this video, I wanted to kind of hone in on a couple of other things that might contribute to depression. And I guess the two things that really come up for me when I think about talking about this in counseling sessions with various clients over the years are cognitive distortions and perfectionism. And we'll probably go into a lot more detail on those things in other videos, but just to quickly highlight, a cognitive distortion might be something like all or nothing thinking or making a generalization. It could be magnifying an issue. It could be minimizing a success, something like that. It could be labeling. Sometimes you might hear a therapist say you're shoulding on yourself. That just means you're engaging a lot of shoulds, which typically when I hear should, I think shame. So just different things like that. And so wanted to talk about a couple of strategies if you begin to notice that, and sometimes even just the act of questioning a thought can help just give us a little bit of a pause before we fully buy into it. And so even just being able to notice what our thought is, oh, okay, that thought just automatically came in, here's what it is, maybe even write it out, just kind of depends. But noticing what that automatic thought is, noticing if there's any emotions attached to it, and then just kind of beginning to ask yourself, does this fall in a cognitive distortion? Is it possible this is an all or nothing thought? And then maybe looking at, do I have evidence for this thought? Do I have evidence against this thought? And then with all of that, looking at how you can reframe a thought. So you can see how you go to maybe a thought of like, oh, my boss hates me, to going through that process and maybe concluding, you know what, maybe my boss was having a bad day. We all have bad days. So that's one thing to kind of work on, and that's called cognitive restructuring. With perfectionism, and we'll go into this in more detail later, but just noticing kind of highly rigid or a lot of anxiety about making a mistake, or sometimes even procrastination can be a form of perfectionism. And so just beginning to notice that, and then looking at some different strategies that sometimes I'll refer to as anti-perfectionism. Dr. David Burns talks a lot about this. And so looking at, are you out of balance with things? Are you giving 100% to everything in your life, which is unattainable and unrealistic, and beginning to look at what are areas you can give 80%, what are areas it makes sense to give 25%, and just kind of looking at some of those different things. And he kind of has a strategy of having a goal of doing less than you did the day before. So something to that effect. And you can always go above and beyond that goal. So if you end up doing what you did the day before or more, okay, that's just icing on the cake, so to speak, But if you did nothing, then okay, we met our goal, because our goal was doing less than the day before. So it's kind of a cool strategy just to begin to interrupt some of those perfectionistic ways of thinking and doing, which can contribute to depression. So hopefully some of those strategies help, and we'll go into more detail in other videos. Thanks.